My name's Jenny Mindell. I'm a clinical senior lecturer at UCL in the Health and Social Surveys Research Group in the Department of Epidemiology and Public Health. And amongst other things, I lead the team dealing with the Health Survey for England, and that's what I'm going to be talking to you about today. So I'll start off by explaining what the Health Survey for England is, who's involved in it, and how we run it. And then I'm going to talk about 5 particular topics: obesity, alcohol, tobacco, and physical activity, and relate all of this, of course, to sex, drugs, and rock and roll. The Health Survey for England is a series of health surveys that have run every year since 1991. They're quite unusual worldwide because they are health examination surveys where we actually take measurements as well as just asking people questions. It was initially commissioned by the Department of Health, but since 2005 it's been commissioned by the NHS Information Centre. The first 3 were run by the Office for National Statistics, ONS, but since 1994 the tenders have been won by the Joint Health Surveys Unit of NatSen, the National Centre for Social Research, and UCL, our department. Each year we take a new random sample of the general population. These are chosen by address rather than by individuals because we don't have a population register in this country. So we take a random sample of private addresses and we send the households a letter explaining briefly about the survey and saying that an interviewer will call. The interviewer then visits the house, explains about the survey and asks people to take part. And if they agree, there's some questions about the actual household and then individual questions to usually all the adults. We have a maximum of 10, and every couple of years we find one household with more than 10 adults living there, but not often. And we limit it to 2 children in a household because for children under 13, it's the parent or guardian who answers the questions, and it's just too much for somebody to answer their own interview and more than 2 interviews about children. The interviewer asks lots of questions, but also measures height and weight. For those who agree, a nurse then visits, a few more questions, more measurements, such as waist circumference and blood pressure, and also collects some biological samples, for example, saliva for cotinine or urine. Each year, we have a core module of questions and measurements and different modules where the focus changes from year to year. And one of those additional modules in the survey that's in the field at the moment, HSE 2010, includes questions on contraception and sexual health. We've not asked about this before, although other surveys have. The results should be published in a report around December next year, and we'll be holding a half-day seminar here about it in June 2012, if anyone's interested. I'm afraid if by sex you mean sexual activity, that's the only information we have, or rather, we will have. But there's a lot of other information in the HSE about sex because we do virtually all the analyses separately for men and for women. And where the numbers are big enough, we also do it separately for boys and girls when we're analysing the children's data. So I'm going to start off by talking about obesity. Now, the measure most commonly used for obesity is body mass index, or BMI. And this is defined as your weight in kilograms divided by your height in meters squared. It's a bit more complicated for children because what your BMI should be depends on your age and your sex. And there are also various different thresholds that are used. But using the ones that the Department of Health use at the moment, in 2008, amongst children aged 2 to 15, 15% of boys and 14% of girls were overweight, and 17% of boys and 15% of girls were obese. That's 1.5 million children under 11 in the country who are overweight or obese, and a further 1 million adolescents aged 11 to 15 who are overweight or obese. So what you might call a big problem. And you can see there's not really much difference between boys and girls. It's a bit more straightforward when we're looking at adults. An adult should have a BMI between 18.5 and 24.9 kilograms per meter squared. We also assess obesity by measuring waist circumference. And for men, a healthy waist would be less than 94 centimetres, and for women, it's less than 80 centimetres. And we measure this, it's a difficult measurement, and there are different people measure it in different ways, and I'm sure you'll all go home and check your own. You may have read or heard about December last year, the Science Museum had a competition to find Mr. and Mrs. Average, the average man and the average woman in England. And a couple of weeks ago, they announced the winners, and their prize is that their nude bodies are being modelled in paper and will be displayed at an exhibition opening this autumn. Now, some of you may have wondered, how does the Science Museum know what the average man and women look like? And the answer, of course, is the Health Survey for England. So the average man in 2008 in this country was 1.75 metres tall. That's 5'9". He weighed 83.6 kilos, which is 13 stone 2. But unfortunately, his body mass index was 27.2, which means he was overweight. And his waist circumference at 97.2 centimetres is high. The average woman was 161.6 centimetres, which is 5 foot 3.5. Her weight was 70.2 kilos, which is 11 stone, and she was also overweight with a very similar BMI, 26.9. Her waist circumference was also high, 87.4 centimetres. But unlike the man whose waist was in the middle of that range, the woman's waist circumference is very close to the top end. And the higher your waist circumference, the higher your risk of adverse problems, health problems. So why is obesity important? Obesity greatly increases your risk of developing diabetes, but also high blood pressure, heart disease, stroke, and a number of cancers. It causes about 9,000 premature deaths each year, but this figure is set to rise because of the increasing numbers of people who are obese. And each of these people loses, on average, about 9 years of life. It costs at least £3.3 billion to the country, and that's made up of productivity that's lost and taxes that aren't paid by people who can't work, as well as increased welfare benefits and the actual cost to the NHS of treating people. So it's a big problem, but is it also a growing problem? And is there a sex difference? This chart shows trends in overweight and obesity in children aged 2 to 15 from 1995, when we first started including children, to 2008. It's a 3-year moving average. The red marks are for boys, the blue marks are for boys and the red marks are for girls. And the solid line is overweight plus obesity, while the dotted lines are obesity. So obesity, and this is overweight plus obesity, and the distance between them is people who are overweight but not obese. And the two things to notice is that really there's not a lot of difference between boys and girls. The most recent point, boys do seem to be more obese, and that's the figures I gave you, but this may just be a chance finding because they are pretty close. But the most important thing is the shape. It goes up, flattens out, and is definitely not rising and appears to be falling. Each year we say, well, perhaps we better wait for another year's data before we can be sure it's coming down. But it certainly is no longer rising, looks as if it's coming down. And that's for children. But what about adults? Similar chart blue for male, red for female. That's men who are overweight or obese, and men who are obese. So the distance between them, that difference, represents people who are overweight but not obese. So two big differences here from children. Firstly, although there's no difference in the proportion of men and women who are obese, there are an additional men who are overweight compared with women. The proportion of the population who are overweight is 10 percentage points higher in men than in women. 42% of men, 32% of women who are obese, whereas with are overweight, whereas with obesity is 25% of women, 24% of men. The second thing to notice is that although it's flattening, that it rises and then is flatter, but it is still going up. There's no end to the increase yet in adults. I've mentioned waist circumference a couple of times and said it's another way of measuring obesity. Abdominal obesity, or central obesity it's sometimes called, or central adiposity, because it measures the amount of adipose or fat tissue around the waist, is particularly important in predicting disease, particularly diabetes and heart disease. And a raised waist circumference that gives you a substantial increased risk of poor health is defined as greater than 102 centimetres in men and greater than 88 centimetres in women, which isn't very much more than that average woman's waist circumference already is. Now, whereas for general obesity, more men were overweight than women, we find the opposite for abdominal obesity. 34% of men had a raised waist circumference, but it's 44% of women. We also find differences between men and women when we look at social inequalities in health. This chart, and various others like it, up the side is the percentage of the population who are affected. And across the bottom here, we divide the population into fifths by equivalized household income. This is the household income adjusted for the number of adults and the number of children in the household. And you can see that in the highest income households, 19% of women are obese. And in the lowest income household, it's about 31%. And there's a fairly smooth gradient across. Now, we don't see that pattern in men, only in women. And if we look at abdominal obesity, again, the proportions are higher, but again, you see this fairly smooth rise across the income fifths in women, but no particular pattern in men. We collect a lot of information about prescribed drugs from people who have a nurse visit. So, for example, we've been able to show that the proportion of people treated for high blood pressure has increased, but not enough. And the proportion of people on treatment whose blood pressure is well controlled has increased, but not enough. The proportion of people with a stroke or a heart attack who are on statins, drugs to lower the cholesterol in the blood, has increased markedly over the years, and in 2006, it was about 3/4 of them. It should be more than that, but that's better than previous years. And a good proportion of those people had a cholesterol level that met the previous target, but are not yet meeting the newest target. We can also show that people who are at high risk of developing heart disease or stroke, people who've got, for example, high blood pressure or diabetes or smoking and are overweight and obese, more of those are taking these drugs than previously, but again, not nearly enough. But on the other hand, we've also been able to show that people who aren't at high risk are by and large not taking these drugs, so that's good. We don't collect any information about illegal drugs, so I'm going to talk some more about alcohol and smoking. We ask people whether they drink alcohol, and if so, how often, And if they do drink alcohol, how many days in the previous 7 days did they drink alcohol? For those who did drink, we then ask how much they drank on the day in the previous week that they drank the most. There's been quite a lot in the papers about binge drinking and about England being the binge drink capital of the world. Binge drinking is defined as drinking more than twice the daily recommended level in one day. So for men, that's more than 8 units, and for women, that's more than 6 units. Now, these charts, you might not be surprised to work out that the men are in blue and the women are in bright pink. These are percentage of people who drank alcohol in the previous week. But of those who did, more than 50% of men and 50% of women aged 16 to 24 drank more than twice the recommended level at least once in that week. And you'll see that this proportion who were binge drinking falls with age. Very few of the oldest participants were binge drinking. The other interesting thing to note is that the youngest and the oldest, there's not really any difference between men and women. But for the 25 to 74 year age groups, more men were binge drinking than women. And what do they drink? Well, for men who only drink one thing, it's generally beer. And for women who were only drinking one type of alcohol, it was mostly wine. But just as many of them had at least 2 types of alcohol. We also find differences by region. Some regions, people were more likely to binge drink than others, and average consumption was higher. So turning to smoking, in 2008, 24% of men and 20% of women said that they smoked cigarettes regularly, which means at least one a day. Again, it mostly falls with age, other than this peak in men aged 25 to 34. And there are 2 reasons that it falls with age. One is that people quit smoking, but the other reason is that they die. 1 in 2 smokers of 20 a day die prematurely. So these are people who are still current smokers. And at most ages, more men than women. If we look again by income, similar to the chart for obesity, but the gradient between those with the highest income and those with the lowest income is much steeper. This is one of the steepest gradients with income. And smoking is one of the main reasons close to causing death, causing disease, for health inequalities. So smoking varies between about 17% in the highest income fifth of men to 39% in the lowest income men, and in women from 11% to 35%. And the proportion of children who take up smoking is also very markedly related both to parental smoking, and therefore those in the lowest income are more likely to have children who take up smoking because they see people around them smoking, as well as it being related to income and education levels. So did the smoke-free law make a difference? You may remember in the dim and distant past, you could go into a pub and have your quite a large nicotine intake just from being there. But that changed on the 1st of July 2007. Now all these charts that I'm about to show you show the results from the 2007 health survey. The dark blue are people in that category that we saw in the first 6 months, and the pale blue are people in the same category that we saw after the 1st of July. So they're not the same people. And what we found, and these charts are for adults who said that they didn't smoke and whose saliva cotinine level, cotinine is made by the body from the nicotine that you are exposed to. and you can tell from the level whether somebody's smoking themselves or whether at much, much lower levels they're picking it up from elsewhere. So these are people whose cotinine levels said they weren't smokers, and they said they weren't smokers. And you can see that there was a very significant fall before and after 2007 in men and in women. And we see similar falls in all age groups, and the higher the level was before July, the bigger the fall. We also see the same type of fall and the same size of fall regardless of what people's occupation in the managerial and professional group, intermediate, and routine and manual group. Now, if you just look at the left-hand side of this slide for a minute, that shows cotinine levels by people's self-reported exposure to tobacco smoke. Now, you would expect that the levels in people who said they were exposed is higher than in the people who said they weren't exposed. But we were quite surprised how high the levels were in people who said they had no exposure to tobacco smoke. But whichever group they were in, it fell markedly after the legislation. On this side is the same data by their answer to the question whether smoking was allowed in the home most days. Again, you'd expect higher levels in those saying yes than in no. And remember, these are all non-smokers. And again, you see a fall in both groups. There are far fewer people in that group. Now, this is looking at children. Now, you wouldn't actually expect the legislation itself to have a direct effect on children, or not very much of an effect, because places that children tend to go, schools, shops, were by and large smoke-free already. And the places that the legislation affected that weren't already smoke-free were, for example, pubs and workplaces, and children don't tend to be there very much. And in fact, that's what we've found. So again, these are the cotinine levels in children aged 4 to 15 who didn't smoke. So for the first few points represent 1 point a year, and it really didn't change very much. From 2005 onwards, the results are for every 6 months. And the fall happened here, the latter part of 2005 and during 2006. And what happened during that time is a lot of publicity around the need for the legislation and the reasons for the legislation. So there were some government advertising campaigns about protecting children from smoke. There was also a lot of advocacy and lobbying work to persuade politicians and others of the need to protect people from smoke. And obviously, a lot of parents were realizing that if it's important to protect adults at work from smoke, then they should be protecting their children. And some colleagues in Bath are looking at this in more detail, but we think that this fall was related to all this publicity, and that's why it happened before the law. So it was because of the law, but it wasn't because of the implementation of the law. The other important thing here is our dear friend John Reid, who was very concerned, allegedly, that by introducing this law, parents who couldn't smoke elsewhere would go home and smoke all over those children. And there has not been an increase. And if you break that down by various other factors, there has not been an increase in children's exposure. Now, this is similar to the previous slide, but more condensed. So there's a similar pink line for the salivary cotinine, but over different periods. All the baseline, 2005, 6, and then split for 2007. And I know I shouldn't have that, but it makes it easier to show. These bars show the proportion of children who had no detectable cotinine, so they were not exposed at all. We have a very expensive test that's very expensive because it is able to detect very, very low levels. So if it's not detectable, it really isn't there. And you can see that the proportion of children doubled between 2005 and 2006. And then it increased again in 2007. So our verdict is the law worked. Rock and roll. I'm afraid this is a bit of a cheat. I don't have any information on rock and roll. But I do have information on dance, so I hope you'll accept that as a compromise. We don't ask about physical activity every year, because by the time you've gone through every activity people could do, and how often they do it, and for how long, and what intensity, it gets a rather long questionnaire, and the interviewers and sometimes participants rather lose the will to live. So it's something we only do occasionally. But we did it in 2008, and I'll show you some of the results. As well as many other questions, we ask a long list of types of activity, and people identify which ones they've done, and then, having said that they've done it in the last 4 weeks, we ask the more detailed questions. So this is the proportion of people, of adults, who have done any aerobics or keep fit or gymnastics or dance for fitness in the 4 weeks before they were interviewed. Probably you're not surprised that there are more women than men. And it's probably not surprising that the 25 to 34-year women are the group that have them, who are most likely to be taking part. We then ask, have they done any other dancing? Here, the 16 to 24-year-old women are obviously very into dancing. But what is very interesting is that this pattern, that the older men are dancing far more, and by the time you get to 75, the numbers are equal. Now, one could put forward all sorts of theories for this. Is it that people take up dancing as a way of exercising when they can't do other things or don't want to do other things? Or is it that this is a group of people who've always danced, and as they've got older, they have continued to dance? I'm guessing, I'm putting myself out on a limb here, but I'm guessing that the sort of dancing being done by this group and the sort of dancing being done by this group might not be the same. I'm also guessing, and this is pure guesswork, that this sort of dancing probably needs 2 people dancing as a couple most of the time. But again, this is pure guesswork. When we've asked all the questions about physical activity, we then derive a summary activity variable. Have people met the current government recommendations, which is to do at least 30 minutes a day of activity of at least moderate intensity, at least 5 times a week? And try saying that after you've had a binge drink. So, what we've got on this slide is, of those people who've done any of the aerobics, keep fit, gymnastics, dance for fitness, which category did they mostly fall into? So nearly 3/4 of the men, there weren't that many men, but of the men who did that sort of activity, nearly 3/4 of them fell into this group meeting the recommendations, and half of the women. And virtually all the rest were in the some activity group. What about those doing other dance? Well, not quite so many met the recommendations, but very similar pattern. More men than women in this group, and almost all the rest there, but some more in the lower group. Now, in 2008, we did something we've not done before, and that is, as well as ask people about their activity, we actually measured it. This is an actigraph. You wear it on a band round your waist, over your hip, and it measures movement in the vertical axis. So this is what we found from people's questionnaire answers. The black represents those who met the recommendations, and you can see it's higher in men than in women, and it falls with age. The pale blue that you can hardly see is people who hardly did anything. Because it's done on a 4-week basis, that's people who did 30 minutes of activity on fewer than 4 days in the previous 4 weeks. And the dark blue are people who did something in between. This is what we found from the accelerometry data. Same key, same charts. These are people who did not a lot. And unfortunately, not many people actually met the recommendations. So how many did meet the recommendations? Well, from the questionnaire, 39% of men and 29% of women. From the actograph data, and this is for people who wore it for 7 days, 6% of men and 4% of women. Now, it's not that people lie in surveys, it's just that it's difficult to remember, and do people answer what they meant to do rather than perhaps what they actually did? And the intensity, how do you report that? And perhaps it wasn't quite as long as you thought, or quite as often. But even if you're in that middle dark blue group and not in the black met the recommendations group, it's still good. It's not as good as it would be, but it is still important for your health. This slide is actually from the Scottish Health Survey, but I'm sure that if we did the analyses for England, I would be surprised if we didn't find the same thing. So this is the proportion with a raised waist circumference. And this is for adults, men and women together. And this is the type of activity. The pale grey is no time. The middle bar is people who spent 1 to 29 minutes a day on average, i.e. less than half an hour, but some time. And the darkest bar is people who spent at least half an hour a day on average. The good news for people who don't like housework is that domestic activity really doesn't affect your health. Sports and more formal exercise and dance would be included in that group. Although the lowest proportion of people with raised waist circumference is in those who did at least half an hour a day, even doing less than that is associated with a lower risk of a raised waist circumference. And for walking, it really didn't matter how much you did. If you walked, you were less likely to have abdominal obesity than if you didn't. It was half the proportion. So to sum up, there are differences by sex in most things. For example, smoking prevalence. There are differences in what people drink. More men are overweight, but more women have abdominal obesity. Looking at drugs, smoking, the prevalence is falling, but not enough. Exposure to tobacco smoke is falling, but not enough. Children are still exposed, but it is improving. And there will be a new report being published Wednesday next week, which you might like to keep an eye out for in the papers. There's a worrying amount of binge drinking. And the news regarding prescribed drugs is doing well, but could do better. And finally, looking at rock and roll, dancing is good for you. People who dance are generally more active. Dancing helps meet the recommendations for physical activity, and people of any age can and do dance. I'd like to thank those who took part in the surveys and the interviewers and nurses who did the fieldwork, and particularly my colleagues and those who helped me with some slides and some of the analyses for today. If you are interested in having more in-depth information about the health survey, we are holding a half-day seminar here on the 1st of June, which will look at these 2008 results in more detail. Thank you.